Jen Rabiner and Tasha Demkiw.
Hello, my name is Jen Rabiner. I lead the product team here at Hint Health, and I am thrilled to be here today with my colleague Tasha Demkiw, Head of Customer Success at Hint Health. So Tasha and I are going to talk to you today about an initiative that we've been focused on in 2020 around measuring practice health. So that's certainly nothing new for Hint to be focused on DPC success, but in 2020, we wanted to use our data, use a data-driven approach at really measuring practice health, looking at how all of you were doing in DPC success, as well as make sure that our time and our energy are focused on the things that are helping you achieve maximum practice success. So, as I mentioned, we've been looking at this in all of 2020, and we're doing this, in the beginning of the year. And of course, the world turned upside down in the March and April timeframe, and this initiative really took on even more significance to us as we were watching everything that was happening in the medical community, and then keeping a close watch on what was happening in the DPC community. And now, 6+ months into everything, we know that the DPC model has proven itself not only to be resilient against everything that's happening, but has also continued to truly thrive. So it really just underscored the importance of this practice health initiative. So I'm going to turn it over to Tasha. She's going to talk to you a little bit more in detail about the ways that we are measuring practice health. And then I'll come back in a few moments and talk to you about some of the things that we are actually working on to help you achieve further success in DPC.
Thanks, Jen. Since Hint's inception 7 years ago, we have been focused exclusively on empowering the growth and success of the direct care movement. We wake up energized to come to work every day alongside the innovative physicians and thought leaders that are demonstrating a profound impact on the US healthcare system. For the last 5 years I've been at Hint, I've had the honor to witness the positive impacts that DPC is having on the lives of our physicians who are finally freed from the third-party payer system. And I've heard the remarkable stories of the unparalleled quality of care that their patients are receiving. And all of us at Hint feel incredibly excited by the potential impact DPC will have on a future world of mass adoption. But in order to take DPC to the masses, we need to ensure the survival of every provider that wants to practice DPC. As Jen mentioned, and as we all know too well, the world is rapidly changing, and DPC is already perfectly suited to support the care delivery of 2020 and beyond. Given the new demands for access and care, we need to help grow the DPC community now more than ever, and ensure that you as individual DPC practices are thriving in the model. We think of ourselves as so much more than a software vendor. We strive to bring the very best technology, practice development resources, and growth channels to the hands of our providers and practice administrators. When we think about thriving DPC practices, we think about the technology and services that we here at Hint can deploy to free you to be doctors, allowing you to focus on what you do best, patient care. When we decided to make Thrive our main focus of 2020, we turned to you to tell us your business goals and aspirations. We leveraged our DPC community forum to ask our providers what their #1 goal was over the next 12 months. The answers ranged from dropping insurance contracts to a reduction in paperwork and increase in operational efficiency. However, the responses were overwhelmingly skewed towards growth objectives. Most of our providers wanted to grow their panel, double or even triple their practice size. Knowing that our providers have capacity they want to fill, we started to ask ourselves, how do we support the DPC community in filling that capacity? How can we reduce startup time and cost for a provider transitioning into direct care? And how do we accelerate the growth of our existing community? We knew we needed to ensure that our clients weren't just staying in business, but thriving. We've seen firsthand how a thriving DPC practice can become a DPC network and in turn help other DPC practices grow their panels and thrive. We wanted to continue to perpetuate that cycle from within our community, but how exactly do you define a thriving DPC practice? We started to look at a few metrics that we felt mattered to the DPC providers and that would be good indicators of overall practice health. Additionally, we didn't want to just define and monitor practice health metrics. We wanted to launch programs and features that would move the needle. The first metric we chose was panel size, since filling capacity was the most ubiquitous goal from our community survey. Based on the panel size goals submitted and the limits we see within the HintOS application, our community of providers has a capacity of approximately 1.2 million patient lives just waiting to be filled. We started to look for ways to fill the gap between where you're at today and where you want to be. The next metric we use to define a thriving DPC practice is collections. As a core value proposition of Hint, we needed to ensure that you can collect from your patients and employers accurately, on time, and with minimal effort from your team. We looked at how timely payments were being made, how effective we were at collecting following a decline, and the distribution of payment types to find ways to help lower merchant fees. Lastly, we looked at member growth and churn. Knowing that our providers have capacity, how quickly are they filling it? And how can we help you understand why patients are leaving your practice so you can prevent churn and don't have to make up the difference every month? Across our client base, we see an average monthly growth rate of about 3% or yearly growth rate of 40%, which is pretty impressive. What if Hint could facilitate connections between DPC providers who have capacity and plan sponsors who are bundling DPC in their offering? What if we could surface the business insights and practice development programs you need to run a sustainable DPC practice and ensure interested patients aren't falling through the cracks at enrollment? These are the three metrics we are using to define Thrive. Now, Jen's going to walk us through a few of the initiatives Hint's leading to help move the needle.
Great. Thanks so much, Tasha. So as I mentioned, one of the major reasons that we want to focus on looking at practice health is so that we make sure all of our time and energy is spent on the work that will help you achieve greater success. So I've got a couple examples up here on the screen of different things that we have done this year and that we're still working on, through the end of the year, through our product, HintOS, through our technology to help you thrive. All right, so the first example I have over on the left, abandoned sign-up emails that we launched back a few months ago in July 2020. So as any of us who do online shopping know, maybe we've done it a little more often in the last 6 months, I know I certainly have. When you don't finish a purchase, maybe you put something in your cart, you start the process, but you don't actually make that purchase. Some companies have now started sending emails saying, hey, I think you forgot something. We still got something in your cart if you want to come back. And so we thought we would try doing something similar for potential members who start the online enrollment process, but don't complete the membership for whatever reason. So we were looking in our data saying, hey, I think that we could potentially bring some of these potential members back into the flow. So we launched these abandoned sign-up emails back in July, and for the practices who had that turned on, we've already seen 1,500 new enrollments as a result of this work. So that's just one kind of small example of something that we've done to help make sure that we're maximizing the number of active patients that you have. In the middle there, a new project that we have that we'll be launching actually just in the next couple weeks called Practice Pulse. So we know that within HintOS, there's a ton of data that you need to run your business, to know how your business is doing, just to operate your business. But we know it can also be a little bit hard to extract all of that data and insight that you need. So one of the things that we're trying here, something called Practice Pulse, is that any kind of information you might need on a daily or a weekly basis, we want to put that front and center right as soon as you log into the application, put that information right up front, and then let you drill in and dig in throughout the product as you need to. So that should be launching to a small number of clients in beta, which means we launch it to a small group of clients, get some feedback, make sure it's working perfectly, and really adding value, and then we'll be rolling it out to the rest of our client base as soon as we get that validated. So that's coming in a couple weeks. And then a larger project that will be starting in a couple weeks, hope to get that out again to a small beta group in the first quarter of 2021, is really rethinking and rebuilding our entire online sign-up process. So we think of ourselves as kind of the bridge between all of your marketing efforts out there in the community, whether it's your website or other like email campaigns, things that you might be doing. We're kind of the bridge between that and actually getting an active enrollment enrolled in your practice. And so we have, a great enrollment flow right now, but what we want to do is add more information into that flow so that there's less kind of back and forth and which plan am I buying and which one, was it, which of those doctors, was it that I wanted to choose? So we want to redo that entire process, kind of rebuild that bridge so that we're really maximizing your marketing efforts and making sure that those are resulting in active memberships. So those are some examples, certainly not all of the work that we're doing, but some examples of what we're doing to help drive performance in your practice through our product. And then we also have some examples here of work that we're doing outside of our product through our services to further drive patients to your practice and help you be a thriving DPC business. So first over there on the left, the Dpc Accelerator that many of you have already engaged with through our new and improved Hint community, where you can also connect to each other and have some great conversations. So the Dpc Accelerator is a series of courses that have been done by our internal practice experts who really learned from the best of the best in DPC from all of you. And we put together, essentially a number of different courses. You can, depending on where you are in your DPC journey, can learn, say the examples I have here. If you want to get started with small businesses, there's a whole series of courses that will walk you through step by step how to do that. In the center, there are many familiar names, I think all of whom are at the summit this year, are plan sponsor partners. So these are different types of organizations that are working with employers or with individuals offering a more comprehensive, set of coverage even beyond primary care, but they're putting DPC at the heart, they're embedding DPC, in these coverage options. And so we partner with them so that this is yet another way that we can drive lives directly into your DPC through our partnerships with these organizations. And lastly, we have a plethora of resources and tools available to you, everything from marketing tips and tricks. We have sample agreements, you name it, we've got it to help you wherever you might need some assistance in running your DPC business. And lastly, we're trying something new at Hint Summit this year. So one of the things that those of us who work at Hint love the most about Summit is our opportunity to connect with all of you. And since we can't do that live this year, we're trying a way to do that virtually. So between 7:30 and 9 a.m. tomorrow morning, you can schedule a 15-minute practice health check with a Hinter. So we've got people from across our organization lined up and ready to meet with you, and we can look at a practice health check that looks like what you're seeing on your screen on the right-hand side, where we've taken your data along the lines of those metrics that Tasha was talking about. We can review those with you, get a chance to learn from you, and maybe you can get a chance to learn some of the other things that we're doing at Hint and other ways that you can be involved. And also, as Zach mentioned earlier, we also have the ability to sign up for a one-on-one chat with Beth Holmes, our network development lead. So if you are a DPC who wants to work with plan sponsors, or you are a plan sponsor who wants to work with DPCs, you can sign up with Beth as well in that same time period of tomorrow morning, 7:30 a.m. to 9 a.m. Pacific. The link to sign up for one of those one-on-one sessions is on the screen, and it should also be in the event chat right now. So if you want to click on that on Calendly, you can get scheduled with us, and we will look forward to seeing you there.